So, dear all students, welcome to Unit 2. In this lecture, we are going to see bone marrow aspiration cytology, and let's discuss more about bone marrow. So, in this lecture, we are going to see that what is bone marrow and how the aspiration cytology works. Then we will see from where the sample is being collected in the bone marrow, what is the physiology, indication, contraindications, equipments that are used in this method, then what is the proper technique to do it, complications that may arise, clinical significance, preparation, and personal. Uh, Personal meaning persons, or we can say the staff working on this specific procedure. We will discuss more on that. So bone marrow aspiration is mostly performed for estimating the hematological disorders, and this technique is actually done in two ways. The starting point will be either palpation guided or computed tomography guided. Palpation guided meaning you can first palpate the location where the bone marrow is located, and once you confirm that the bone marrow is here, then the procedure will further processed. And computed tomography guided method will use the one type of camera in which it will be inserted into the location where the bone marrow is situated, and then this procedure will be further proceed. The high diagnostic accuracy is required, for this procedure, because it involves a lot of contraindications and complications. We will discuss this on the further upcoming slides. And this obviously this all steps should be performed using the interpersonal team. It should be the professional team actually. The whatever the procedure is being performed uh, for the bone marrow aspiration, because this process involves very qualified staff who can perform it with accuracy. Okay. So, before going into the procedure part, first you should understand that from where the bone marrow aspiration cytology is sample is collected. So, there are first of all, whenever we are born, there are multiple sites of hematopoiesis. Hematopoiesis meaning the blood cells production. So, whenever we are born, there is multiple locations, but then slowly it becomes restricted to the axial skeleton. That means the main skeletal part or bones which are present in our body. Then whenever you see any bone marrow aspiration cytology, the main actually the anatomy or the main location from where the bone marrow sample is collected is posterior superior iliac crest. Now we will see in upcoming slide that iliac crest, or whenever we are saying posterior superior iliac crest, where it is located. Once I show you the picture, you will know exactly. Actually, it is at the back of our body, back part of our body. Wherever there is a pelvis muscle which is located, it is slightly above that pelvic muscle. Next, in some patient, this posterior iliac muscles, or we can say the uh, amount of adipose tissues are very high in this specific place. So, in those kind of patients, we can also collect the sample from the anterior superior iliac crest, and that is also fine in that patient. And in also there are also exceptional cases in which the sample collection is very hard from both of the side. That means we cannot collect the sample from posterior superior or anterior superior. So in that case, we are going to collect the sample from the proximal sternum, and that we can only done over for the patient over the age of the 12 years old. Okay, so this both of the locations, posterior superior and anterior superior, are fine to collect the samples from the bone marrow. So this is the figure in which you can easily see this is the posterior iliac crest. Okay, so this is, we can say, the posterior superior iliac crest, and uh, in some cases the adipose tissues are very high at this location, so you can collect inwardly from here. So that is anterior uh, posterior iliac crest. So this location is chosen. Why this location is chosen, we are also going to see. The reason is actually uh, it is relatively less painful to take the sample from here. Uh, in case we take the sample from the other place, it is somewhat painful, more painful. So what you need to remember is, first of all, the name of this bone and this part of the location of the body, which is called the posterior iliac crest. And this is actually present in the pelvic girdle where the bone marrow uh, is present. So we have discussed whenever we were studying the hematopoiesis lecture, we discussed about the bone marrow. It is a location where the all type of blood cells are being formed. Okay, it is produced. It is kind of a factory. So this is the ilium part. This is the iliac crest. This is iliac spine, acetabulum, then ischium and pubis. So actually, other parts are not much important for this session. Just you need to understand from where the sample is being collected, right? So it is iliac crest, and in this you can see this type of reddish kind of bone marrow will be observed. So as I have discussed, in some patients it is very hard to collect the sample from the iliac crest. So at that time we are choosing this sternum, okay, to collect the sample. So for the single aspiration of the biopsy site, mostly it is sufficient. So whenever doctor prescribes this kind of bone marrow aspiration, uh, the physician will collect the sample once, and they will assess for the certain type of conditions such as non-Hodgkin lymphoma, some cancerous conditions, or some hematological disorders related to the uh, hematopoiesis. Then, you know, multiple studies have shown that the performing bilateral biopsies yield a much higher diagnostic accuracy. So in this, you can say the diagnostic accuracy is very high. That means you can easily diagnose with a high confidence that a patient is suffering from this and this disease. And mostly it is diagnosed, it is used to diagnose certain cases of non-Hodgkin lymphoma, which is one kind of cancerous condition. And yes, the size of the needle of bone marrow aspiration is also important. It is 2 centimeter. So, using this bone marrow aspiration, we can actually diagnose few of the hematological disorders like leukemia, multiple myeloma, lymphoma, unexplained anemia, and myelodysplastic syndrome. So, actually, these all conditions we can diagnose with very high accuracy. Then we can also diagnose atypical fungal and parasitic disorders such as histoplasmosis, leishmaniasis, cryptococcus, and Q fever. Some of the conditions of this which I have just explained require only the aspiration, and in some cases we may also need to take biopsy sample as well. So this both type of aspiration and biopsy can be enough or sufficient to diagnose these such conditions. Okay. Severe, in severe cases, the contraindications involve severe bleeding diastasis, in which loss of large amount of blood, in which the hemophilia may be possible. Then severe disseminated intravascular coagulopathy, that means over blood clotting. Then thrombocytopenia. Actually, the thrombocytopenia is not a contraindication because these contraindications can be re-evaluated. It can be actually healed using platelet therapy, in which the patients which are having less than 20,000 cells per microliter platelets can be transfused platelets, okay, before the procedure. Obviously, this part we have already covered. So, as we have discussed, the patient with diffuse bony resorption will not be used to aspirate the bone marrow from the, you know, actually iliac crest, but there is also risk involved at the sternum as well, because in some cases the uh, because the sternum is at the very risky position and location, so at that time collection from the sternum is also very hard. Okay. Biopsy of the sternum is always contraindicated due to this type of risk, and even if the patient is healthy, then also it is contraindicated. So for the equipments, it is good to use the computed tomography. In this, the CT machine will help a doctor to see where this iliac crest is located, and then the further procedure will be performed. Then this process is performed by the radiologist and not the doctor. Right? There is a specialized course in radiology. The bone marrow kit should be utilized. So now next onwards we will discuss this bone marrow kit involves which of the equipments, right? This procedure involves the sterile drapes, the bone marrow needle, which is we have talked about 2 centimeter long. Then this is how the procedure is being done. Now, this is the bone marrow syringe in which you will collect the cytological part. This is the anesthesia which is used in this procedure, which is 1 to 2% lidocaine, and this is sometimes uh, given with the epinephrine or sometimes without. It is given. The specimen slides are very important for this, which should be labeled. Okay, and this there is patient name, date, and slide type should be written here. And there are various types of stains which can be made from these samples. Then another thing which is required is vecutainer for the cytological part. One can use heparinized, anticoagulant and ADT anticoagulant. Both are used, and the container is also used in some cases. So purple tube EDTA for the flow cytometry, in which you want to see if the all the blood cells are having a normal structure or not. Then you can also use the heparin for the cytogenomic genetics. So in the to perform the cell related genetics, you need purple, sorry, green colored sodium heparin tube, and then tissue transport medium. This is dried wraps. Actually, it does not contain anything, but you can store the this cytological part or biopsy part. So before proceeding further, there are some requirements for this procedure. First of all, the if the procedure is done using pulpit guided technique, then one nursing staff should be there. If you are using CT, that means computer tomography guided technique, then the radiologist should be there. If you are sedating the patient using anesthesia, then the anesthesiologist should be there, or some equivalent certified practitioner should be there. And also then assistant, or we can say lab assistant, should be there with who can perform the slide and stain related all the things. So, for the preparation, first of all, the patient should be priorly informed about the procedure, and all the institutional guidance should be clear to the patient, and if their relatives are there, if their parents are there, their guardians are there, then they also should be aware about this before going into the procedure. And clinician should have at least informed all these safety concerns to the patient. So now we talk about the technique. So before going into the methodology or procedure, first the radio plaque, or we can say radio plaque grid, which should be used or placed on to the location from where the bone marrow aspiration is to be collected. In next slide, I will show you the exact figure. So this actually radio pack is used to find the anatomical landmarks. So these landmarks are actually the specific location from where you can enter the needle, and this needle will aspirate the bone marrow cytological samples. So usually in this, in some cases, they use the finger breadths from the middle and two finger breadths inferior. So actually these locations are in previous time it was located like this, but currently now we have actually the very advanced technique, so we can directly visualize from where the uh, iliac crest has been located. Okay. So this is the grid radio plaque I was talking about, and this is the fast to find grid. It can also be called as a fast to find grid. In this, the doctors will locate this iliac crest, and then at specific that location, the insertion will be made. So this procedure involves specific guidelines, such as the clinician who is performing this technique should wear the protective equipment like the PPE kit, or not even the PPE kit, but if he can just include the sterile mask, gown, and the gloves, then it is fine. The tray should be there in which all the sterile equipment should be there. Then typical sterile drapes should be there, which I have showed you the picture, so that whenever we are collecting the bone marrow sample, the other part of the body should not get infected by that aspiration, right? Then if you are if you are using the anesthesia, then it should be properly collected into the 23 gauge needle and given using the anesthesiologist, and all the things which are required to do this, because it is a sensitive, it is very sensitive method. It should be performed precisely. So first, the small incision should be made, in which at the entry side, the skin entry side. Once it is inside, the bone marrow needle should not be moved because it hurts the patient very much. And slowly it should be inserted into the region of interest, and then the sample will be slowly collected. Okay, and in these samples you will see the syringe is being filled up. Once the sample is collected, then this syringe will be uh, you know uh, will be put to the another vacutainers wherever you whatever you require. In case if you want to go with the cytogenetics, you will use the heparin tube. In case if you want to go for the flow cytometry, then you will use the EDTA tube, right? So that is about the cytology. And if you are collecting the sample of the biopsy, then you will require a specific transport medium, okay, or a sterile vacutainer. Not vacutainer actually, the sterile the box, sterile box. Okay, so this was it for this lecture. Let me know in the comment box if you have any questions.